Good afternoon, this is Dr. Do again. This video is our quarantine special edition, video number 13. Today I'm going to talk about the, since the coronavirus pandemic outbreak, there's so many information about the test, either antibody test or diagnostic test. So today I'm going to briefly explain what antibodies or antigens, what the test means to you, what in terms of medical standpoint, what are the significance for those tests? Particularly, you understand what is the antibody, what kind of antibody can tell you whether you were currently infected or you were exposed before or you had previous infections. Something like this, not necessarily related to the coronavirus, maybe something else, but just give you some idea what is our immune system, refer to the antibody, antigen, or lymphocytes, or etc. etc. So in order to understand antibody, let's start from the immune system. We have immune system formed with the lymphocytes, lymphatic vessels, and also the spleen, etc. So the lymphocytes, it's the major immune cells. There are different categories. Of course, the B cells, the T cells, you probably heard of it. The T cells is responsible for the cellular immunity, such as TB tests use that T cells, or the skin reactions, something like this, which is the allergy, for example, the delayed hypersensitivity is caused by T cell, etc. I'm not going to talk that today, because I'm going to talk about antibody, which is produced by the B cells. Okay, B cell is a cluster of lymphocytes. B cells will transform into the plasma cells and then produce antibody. Okay, so it's not one word, two words to explain how the B cell becomes the plasma cells, how to become monoclonal antibody, polyclonal antibody. It's a long lecture. It's complicated, undergoing several stages of maturation, clonization. But I'm just going to talk about antibody. Okay, basically the idea is this: the antigen, which has a immunity, or which has a capacity to stimulate the body, the lymphocytes. Okay, the lymphocytes circling in the body and realize there's something, it's like a patrolling, something invaded or something unusual in the system. So the B cell is alerted and then transformed to the plasma cell. Okay, and produce antibody. Okay, under the acute like emergency situation, like life, but this is not called emergency situation. Under the acute infection, the newly exposure, usually the antibody is the IgM, immunoglobulin M. Oh, by the way, there are IgA, IgG, IgM, IgE, etc., etc. But today I'm going to talk two major antibody. Okay, IgM and IgG. What are they? What are the tests for them? Okay, so back to the topic, we say something invasion, like a bacteria, for example, or virus in the body. The patrolling lymphocyte recognize that, oh, that's not normal, that's something from outside, we need to do something. So the B cell is alerted. First produced is the IgM. IgM is a 5 immunoglobulin, it's a unit, okay? It's a very large size. So the IgM is first produced. Okay, usually their incubation period time, 2 weeks or 6 weeks, etc. But regardless, IgM start first place to fight the bacteria or the virus, and the body has the immunity, okay, which facilitated or helped by the T cell to remember, or next time if the same thing happened, the body produced the other long-term antibody called IgG, which is immunoglobulin G. Okay, so usually that is after a couple of weeks or months, the body gradually produced IgG. Okay, so if you, for example, you have the antibody test, you're having fever, you're having coughing, you went to the lab and they test your blood, they find IgM specific to a specific virus. For example, I'm not saying the corona or endo or the rotavirus, for example, which causes diarrhea. But the IgM usually during the acute phase, the IgM is recognized, identified. Okay, if you have the antibody which is IgG, okay, that means currently you're not in the acute phase. You were either remotely exposed or remotely infected. So this is general information about IgG, IgM. There's a specialist for the immunology, either the doctors doing the research or the clinical doctors doing the treatment. But this is just briefly information for you to understand. So if you go to the test, go to the lab, or if you have some disease, for example, the strep, okay, you went to the clinic, feel sore throat, fever, no coughing, the physician told you you might have strep, so let's do the swab. And do the swab sent to the lab, or they do the exam under the microscope. But I'm talking about the lab, the immune test. And test came back, you have the antibody against this specific antigen. So that means you're currently, like if it is IgM, you're currently infected, so they will treat you. If the IgG was found, it's not exclude that you do not have the symptoms or do not have the infection, but it's just saying that you're not in the acute phase. So this is the antibody, antigen, and the test. I hope, and I think you might know, but I just bring here from what I understand about antigen, antibody, what I know, and in terms of management. For example, if you have IgM identified, that means you're in acute phase, either viral or bacteria. Then if bacteria, then the physician will give you antibiotics. If it's a viral, symptomatically manage your symptoms or your problem. But if it is IgG, for example, hepatitis, this is a typical antibody test. There are a variety of antibodies, either against the envelope, the core, the nucleus, and the surface antigen, etc. So the physician will, based on the antibody, to develop the strategy to treat you, either as an acute phase to manage, or just maintain, or just the monitor or watch, see whether there's some flare up later on. So this is about antibody, antigen, and the test. And thank you for watching, and I'll see you next time.